But telling a man he has what is mostly known as a woman's disease can be extremely tough to cope with. Warning signs may include a lump, nipple discharge, a hard knot, or any kind of swelling in the chest area. Redness around the nipple and/or scaling may also occur. Even something as subtle as dimpling and puckering of the skin anywhere on the chest. All of these are warning signs, no matter how small they may seem. Certain genetic factors may also play a role in MBC. Gene mutations are causes for some forms of breast cancer and are currently being studied nationwide. BRCA1 and BRCA2 gene mutations are responsible for approximately 80% of the families with hereditary breast cancer. The biggest warning of all this should be family discussions. Family history, also known as genetic predisposition, accounts for 20% of men who have been diagnosed with MBC. The causative links for the growth of male breast cancers have left many people in the dark. What are the reasons for its formation in a man who has no family history at all? Radiation exposure at a young age has shown to be an important risk factor. According to Morrow MD and King MD, their studies have also shown endocrine imbalances, especially hyperestrogen and hyperprolactinemia, as well as liver dysfunction, particularly cirrhosis, as being implicated in the pathogenesis of male breast cancer. In addition to the risk factors discussed here in Part 1, another condition which is rarely spoken of as a cause of MBC is what is known as Klinefelter syndrome. William J. Gardisher, MD, has stated it to be one of the strongest risk factors for developing MBC. Klinefelter syndrome is a condition that is rare and results from the inheritance of an additional X chromosome. The human body doesn't come with an instruction manual, but knowing one's family history can make all the difference in the world. The Klinefelter syndrome consists of atrophic testes, gynecomastia, high serum concentrations, and low serum testosterone levels. The net effect is high ratio of estrogen to testosterone. Among these other risk factors, this particular syndrome appears to be one of the most scientific. Klinefelter syndrome is more than a hormonal imbalance. Our genetics play a huge role in the way our bodies grow and age. Some individuals blame the environment for the rise of MBC. Sadly, this may be true in many cases. A few environmental risk factors for males are listed as such, according to Scott Connor, MD, PhD. Men who work in steel mills, blast furnaces, rolling mills, or other environments of intense heat have a slightly increased incidence of breast cancer. These work-related risk factors are seemingly due to thermal suppression and androgen production. Upon further research of the environmental causes of MBC, the website menstuff.org revealed men had been exposed to gasoline and combustion products for at least 3 months were more than twice as likely to develop breast cancer as those who had not been exposed. Taken from the original article. The American Journal of Industrial Medicine, the author also links exposure to benzene and certain hydrocarbons, both products of gasoline and diesel fuels combustion. With breast cancer in women and animals, the evidence speaks for itself.